Why do compressive rough surface implants fail in the lower molar region? So, what is the main reason for sometimes failure of these compressive implants? It do fail sometimes. Why? What is the reason for that? Suppose if you have chosen to place the compressive implants of dia 4.55 and the length of 10 or 12 mm after the osteotomy with the pilot followed by the face drill or conical drill, you are going to place the implant with the hand driver. You feel that you got a good stability and anchorage. So after measuring the torque, so you may have 70, 75 or more than that LCM the torque you got. So is the torque is good when you are placing the compressive implant? Usually when you are placing the rough surface implant in the lower mandibular region through the cancerous bone, the optimum torque should be between 40-45 NCM. If it is more than that means if it is 55-60 or sometimes during the placement you will get to know that it's around more than 70 NCM. So what's going to happen? During that time while placement you will have good stability and anchorage with optimum torque. But what will happen later? Here, if the torque is more, means there will be more compressive pressure on the surrounding bone. Here what happens, because of more torque, the bone compression will be there. When there is more bone compression, the stresses are more on the surrounding bone structure, and this produces this will produce the high strain on the surrounding bone, which causes compression necrosis. Compression necrosis is due to ischemia of the bone. So what happens during the compression necrosis? There will be bloodless field. So there won't be blood supply to that area, that particular area, because of high torque. So when there is no blood supply, it will causes compression bone necrosis following the sequestrum formation, which will lead to failure of the implant. So when you have chosen to place rough surface implant in the lower molar region, or for that matter in the upper molar region also, when the implant is placed through the cancerous bone, what you have to mainly think of is the torque. The torque should be optimum of 40 to 45 NCM, maximum of 50 sometimes. If it is more higher the torque, there are more chances of that is compression bone necrosis, which will lead to failure of the implant in later stages, maybe after 20 days or 1 month or 1.5 months. So the torque should be optimum during the placement of these implants in the molar region.